Mid-chain triglycerides, in the very beginning we were talking about that switch, energy switches. It's either the glucose molecule or the ketone bodies. So if you introduce both selectively, of course, brain wants the glucose, right? Because immediately you can just chop, and 2 ATP molecules from every, yeah, it's low efficiency and all, but it's fast, right? Shortcut. Brain is such a tricky thing, yeah, because it needs like 20% of all the energy. So it likes shortcuts. It's as sneaky as the human beings themselves, you know. Always like the easy way. But it's not the easy way ends up, you know, in hell, unfortunately, right? All good roads, they are a pathway to hell. So how can we teach them? How can we train them? First of all, we have to starve them overnight, right? And before they go to bed, we're not supposed to give them food with the carbohydrates, right? Just give them the fat protein food. Fasting overnight, and the first thing in the morning, feed with the mid-chain triglycerides, about 7 grams of mid-chain triglycerides on a fasted state early in the morning. The best source of mid-chain triglycerides, yeah, I mean, here we're blessed, you know, we're literally blessed. Just go into any store, buy a virgin coconut oil manufactured in Sri Lanka, just make sure that it's coming from Sri Lanka and there's no cheating or something. Take a nice big tablespoon and feed that oil first thing in the morning, and make sure that for the next 1.5 to 2 hours there are no other nutrients are given at all. And if you look at the clinical trials, you will find out that your patient's Alzheimer patient cognition after 3-4 months increases by like 40%. Just with a 7 grams of mid-chain triglycerides in a fasted state, first thing in the morning, and do not introduce any other nutrient for the next 90 to 120 minutes. Because if you introduce a single molecule of sugar, carbohydrate, the brain will switch the energy sensor to the sugar metabolism. What happens to those 7 grams of mid-chain triglycerides? They go right in the liver, stored there, and in 3 to 4 months, instead of improvement in the cognitive function, you have a fatty liver disease. Guaranteed. So try not to kill patients also in the process of helping. So I call it the ketone production, the MCTs. It's because it's primarily creates this BHB, the beta hydroxybutyrate, and it bypasses glucose deficiency, because remember that Alzheimer's disease, in fact, is the diabetes type, no, whatever. Now they say there's 4 or 5 types of diabetes type, whatever, but it's the same disease. It's a coacetyl enzyme, A enzyme deficiency.